Good morning. My name is Coral Owen, and I'm the Professional Development Coordinator for the Military Families Learning Network. It's my pleasure to welcome you to today's webinar, 2015 Personal Finance Year in Review with Dr. Barbara O'Neill. This learning opportunity is brought to you by the Personal Finance Concentration Area team of the Military Families Learning Network. Webinar resources, including presentation slides, can be found at learn.extension.org/event/2160. Or event materials right at the bottom of the page. Military Families Learning Network is part of a DoD-USDA partnership for military families, offering research and evidence-based professional development through engaged online communities. You can explore more about our communities and resources at www.extension.org/militaryfamilies. I'd also like to let you know that you can join our MFLN webinar email list by clicking on www.extension.org/pages/62831. We'll be sure to put this link in the chat pod for easy access. This time, I'd like to turn things over to Molly Herndon, who is the Social Media Specialist for the Personal Finance Concentration Area. Thank you, Molly.
Good morning, everyone. I want to invite you to join us online on our Facebook page at MFLN Personal Finance or on Twitter at MFLNPF. And you can also find recordings of our webinars on our YouTube channel. And our speaker today, Dr. Barbara O'Neill, doesn't need an introduction. I'm sure many of you are familiar with her presentations. She has written more than 1,500 consumer newspaper articles and over 125 articles for academic journals, conference proceedings, and other professional publications. We're pleased to have her again for this financial wrap-up of 2015. So I will turn it over to Dr. O'Neill. Thank you.
Okay, thank you very much, Molly, and welcome to everybody this morning. It was great to meet several of you in person at AFCPE 2 weeks ago, and I'm just very glad to see your names in the participant list today. So this is kind of a fun webinar that we do. It takes a lot of time for me to put it together because it's really going through a whole lot of news reports and journal articles. But what it does is it gives us an opportunity to cover a wide variety of topics that probably aren't of sufficient depth to have a whole webinar about that topic alone, but if we kind of smush it into this year-end review, it still gives you the update without having to schedule a lot of different topics individually. So we're going to kind of begin with the 4-H method. If any of you have been involved in 4-H or your kids are involved in 4-H and they do public presentations, there's a format that they use in their publications where you tell people what you're going to tell them, and then you tell them, and then you tell them what you told them. So that's kind of what we're going to do now with the key takeaways, is just kind of preview some of the things that we'll be covering, some of the key messages that we hope you'll take away. And the first is that retirement, and that includes the healthcare costs in retirement, is going to be expensive, and many people are unprepared for that. Also, knowledge of 529 plans and health insurance is limited, and there's a number of metrics about that. And of course, federal income taxes and the Affordable Care Act penalties are now related. Another key takeaway, things that happened this year, is credit card security upgrades have become widespread. And also there's a lot of evidence suggesting that consumer shopping preferences are changing, and we'll get into that. And then looking ahead to 2016, as we always do at the end of our annual review, we are seeing very modest changes to income and estate tax changes in the year ahead. So we believe that we may be one of the only organizations that's doing a financial year in review. You know, we always have the news organizations recapping the news events and maybe the sporting events, but we're really pleased to kind of put this information together and pull it for you. So just a kind of a caution, each slide where we have information has a reference link, so you can see where the information came from, what the primary source was. If you have a second monitor, I encourage you to open up the links, and you'll have to get them from the chat because they don't come from the slides with our system, you can't get them from the slides directly, but we have folks from our team, Molly and Jerry and Marty are all here, and we'll be putting all the links in as we go along. And then we also have on the Learn page the online resource list, so that's available as well to get the links. However, I will tell you, because many of the sources are newspapers, such as the Wall Street Journal and journals themselves, you'll run into what we call affectionately paywalls, where they're not going to show you the article unless you subscribe or pay a fee or something. However, with my experience, what I have found is that sometimes at the paywalls, you're able to see enough of the article. You can get the title, for example, and the author, and the date perhaps, and then what you can do is you can actually use those as search criteria, and sometimes the articles will let you in through a search, but they won't let you in through a link. So I'll just throw that out there if it's able to help you find these sources. But we do have a reference source for every event in case you want to read up more about them. Okay, so in the chat, I was throwing out a question for some of you who are a little bit early. What do you think was the most significant personal finance event of 2015? So I hopefully some of you have had 10 minutes or so to kind of ruminate on this question. Just thinking about all the events that have happened, and some of them don't necessarily even have to be financial events. They could be political events that had financial implications. Maybe something come from the Supreme Court, or laws that were passed, or new products. Okay, so I'm seeing Norman mention MyRA. Yeah, actually, they don't have the I in there. It's just MY and then RA. And yeah, we're going to talk about that. We actually have a webinar on that on Friday through the Financial Security for All Community of Practice. So at noon on Friday, if you're interested in learning more about the MyRA, come to our webinar. It's 1 hour from noon to 1 on Friday afternoon. Okay, so changes in security for credit cards. Yeah, and many of you have probably been experiencing that, where you're dipping your card now into a machine instead of swiping it as you've done in the past. Jerry saying another option for the keywords for the search. Okay, and you might be able to get the news source that way as well. Okay, good point. Not usually significant, but yeah, the dates for the FAFSA. Yeah, that could actually be very significant if it means making some adjustments in perhaps declaration of income, capital gains, that kind of thing. Yeah, so that's a big change. Fiduciary changes for financial professionals, healthcare. Jerry's mentioning the CFPB research report that came out on financial well-being. Yeah, the OPM hacking and how many people that's affected. Okay, so we've got lots of different events that have taken place, and many of these are things that I'm actually going to be covering. So let's move on, and I've kind of grouped them into categories. So the first category is some personal finance studies that were done. And some of these were done kind of in the academic literature. Some of them are coming from maybe corporate research, but they're basically studies where some topic was researched. And if you were at AFCPE 2 weeks ago, we had a wonderful panel and subsequent presentations talking about building the bridge from research to practice. And that's really what this webinar is all about too, incorporating some of these findings and what do they mean. So the first one that really stood out to me, because I do a lot of work at the intersection of health and personal finance, is this study that was published in the last issue of the Journal of Financial Counseling and Planning, which is the journal that AFCPE members receive as a member benefit. And what they found is that individuals who engage in health search behaviors, health information search. So they were really talking about nutrition labels, reading all the details on those food labels. They found that people who did that were more likely to engage in financial planning activities. And what they did is they used 5 retirement readiness activities to kind of proxy financial planning. And they had a pretty big sample, 4,825 cases. And they found that while there was no relationship between the physical activities, like exercise and wealth and financial planning, the relationship was in the cognitive processes. So it kind of leads to perhaps an indication that it's how people are thinking about doing things that really has an impact. So I guess an implication in practice is kind of pay attention to your clients' health practices as well as their financial practices. It might give you some indications about their behavior. Another research study that came out, and this was through the Employee Benefit Research Institute, or EBRI, they found that there was a correlation between people who had little or no assets and those people who died at a relatively young age. We're talking between age 50 and 64. And it was probably due to their poorer health. So again, a relationship between health and personal finances. And they found that households who lost members at these relatively young ages were also households with lower income and assets. And 29.8% had nothing left when they passed, and they were actually likely more worse off than people in general who were 85 plus, people who'd been living maybe 20 years in retirement. And their sample came from the University of Michigan Health and Retirement Study. So again, it's kind of a sobering realization there. Also talking about health habits and personal finance, this was a study that put a cost on smoking. So this might be information if you've got some clients and you want to kind of encourage them to give up the habit, so to speak, not only for the health aspects but also for the financial ones. This was a study by WalletHub, and they reported it on a state-by-state basis. And the reason they did this, of course, is because there's a lot of taxes built into cigarettes, and the prices can vary quite a bit when you cross state borders. And they looked at everything, not just the cost per se, but the healthcare costs, the income losses related to that, life insurance, the higher premiums that you pay when you're a smoker, that sort of thing. So that's kind of an interesting website. And again, if you're interested in drilling that down to your own location, just go to that article, to the website, and you can find the costs for your individual state. Okay, also with the health theme, I kind of worked through my file cabinet, so I had them organized by title, just how you're wondering how I came up with these titles in order. So this was a study from the Journal of American Medical Association, and they found a drop of 7.9% in the number of Americans who were uninsured, and particularly in the minority populations. However, they did state in their conclusions that it's impossible to say whether it's solely directly related to the Affordable Care Act. There could have been some other changes, economic recovery, the fact that gasoline was cheaper during this recent year. There could be other reasons why people are picking up health insurance, but certainly it's good news that fewer people are lacking health insurance. Also about health insurance, this was a study from the Robert Wood Johnson Foundation, and they were looking at uninsured people between 18 and 64, so obviously people who are too young for Medicare. They had a sample of 469 Latinos, so they were particularly looking at that population. And they found, again, I guess you would call it disconnects in what people say and what they do. Most of these uninsured people thought that health insurance was important, but then when you asked why they didn't have it, because again, this is a sample of uninsured people, costs remained the main barrier. And people were thinking about all the out-of-pocket costs. So it was the premiums, but it was also everything else. And the authors of the study kind of concluded that one of the reasons perhaps why people are still remaining uninsured is that they can still get care. You can go to clinics and that sort of thing and pay the out-of-pocket, and people might perceive that as being a cheaper alternative. Of course, now we have the tax penalties as well, and we'll get into that later. Also, they found that a number of people said that they perceived insurance as a commitment, and they just didn't want to make that commitment, perhaps because their incomes were kind of erratic and that sort of thing. And then the research also found that there were a lot of knowledge gaps. People didn't understand the tax credits that they would perhaps been able to receive to lower their out-of-pocket costs, and also special enrollment situations where they can get into with the Affordable Care Act marketplace if there's a change in their family situation, for example. Okay, moving along from health insurance to kind of retirement, again, still talking about health, but now looking at the retired population. This was a study making a projection of the costs of health care for older adults, people who are receiving Social Security. And they found that a 66-year-old couple, again, they pegged it to 66 because that's the full retirement age for a large swath of people, including many of the older baby boomers. So those folks who were retiring in 2015, getting average Social Security benefits, they could expect their medical costs to consume 67% of their lifetime Social Security, and about 90% for a 55-year-old couple that's retiring in 10 years. So pretty scary projections, because what they were doing is basing it on the growth of Social Security, which has averaged about 2%, but we all know that next year there isn't going to be a COLA at all for Social Security. The medical costs have been growing a lot faster, and then there are, of course, a lot of costs that are not covered by Medicare, such as dental and vision care and hearing aids, that sort of thing. So just very scary that people will be spending more of their Social Security income on healthcare costs. And of course, that was a big issue even this year with the whole discussion about the hold harmless provision with the Medicare increase and the fact that there wasn't any increase in Social Security for the COLA. More scary, if that wasn't scary enough, here's another estimate coming from Fidelity, and they did a retirement health care cost estimate, and they found that since 2005, so in the past decade, healthcare costs were up 29%. And they estimated that for a couple with two spouses age 65, that they would be spending $245,000 out of pocket for health care expenses. This assumes Medicare. This is just everything else that would be on top of Medicare. And their analysis also did not include long-term care. So they're pretty much just talking about all the out-of-pockets and maybe the Medicare supplement insurance, or people are enough to have retiree health insurance through their employer. There might still be some cost sharing involved with that. So that's kind of what they were looking at. And they found that healthcare is the top concern for 3/4 of couples, but only 22% had actually factored it into their retirement planning, where they actually inputted into some kind of calculation to make sure that they had enough money for that. Also in the area of retirement planning, kind of moving from the healthcare into retirement planning, TIAA-CREF did a survey of 1,000 people earlier this year, and this was reported in Financial Advisor magazine, which is a magazine for a lot of financial planners receive that. And they found that 84% wanted to have a guaranteed income stream in retirement. 46% were concerned that they would run out of money, but only 14% had purchased an annuity to secure a steady stream of income. And even more scary, 29% were not saving anything at all for retirement. So again, just a big disconnect between what people say they want and what they're actually doing to prepare for retirement. Also, every year, as you probably know, the Employee Benefit Research Institute puts out their annual retirement confidence survey. And they usually put this out in April, and they kind of time it in with Financial Literacy Month and other events that take place in April. So they looked at 1,003 workers and 1,001 retirees, so about equal amounts, people who are working and people who've already retired. They found that almost a third, 28% of the workers had less than $1,000 in savings and investments. Now, last year in the 2014 survey, it was 36%. So it's kind of ranged in that about a third of workers category have less than $1,000. 57% in the 2015 survey said they had less than $25,000. And when you think about it, that's not hard. People are going to have a life expectancy maybe 25, 30 years. Let's say 25 years. That's $1,000 a year. That's not going to go very far. 50% of retirees left the workforce earlier than they had planned, either to health or downsizing or caregiving, some other reasons where they weren't working as long as they thought they would. And then 69% said they could save $25 more than they were currently saving. So that would average out to, $1,300 a year, maybe plus a little bit of interest. So fair to say, again, there's a disconnect between what people, or say they could do and what they are actually doing in this survey. And then another interesting piece of research that kind of relates to retirement is we saw at the end of last year and then also through this year some studies that have been modeling increasing what they call glide paths. And glide paths just means kind of an escalation, if you can kind of think of a staircase going up from the bottom to the top of the staircase. Traditional wisdom has always been that people would have declining percentages of stock in their portfolio as they got older. At the very least, it would be static. It would be the same. But in many cases, it would be going down. And I'm sure many of us have seen the guidelines, the 110 minus your age, or 115 or 100, depending on what risk tolerance people have. But the implication of all of those guidelines was always that as you got older, you would have less stock. But now, with some of the new research that's been coming out, they're actually finding that a portfolio can last longer if the stock equity percentage actually increases as people get older. But of course, that's not palpable to a lot of people. So what many financial advisors are doing is kind of framing that as kind of a bucket strategy, where you would have different buckets or pieces of your assets, and the money that you have targeted for your later years, maybe in your 80s and 90s, would be the money that would remain in equities, and then other monies would be, of course, more short-term. And you'd want to have a pretty decent cash allocation just to ride out all the volatility that you would see in the stock market throughout your retirement. So again, challenging the conventional wisdom. And those of you who are at AFCPE, you remember that I was on the panel and I talked about one of the benefits of research is that it does keep our content current, what we're teaching people in programs or in our counseling sessions. And so this is a new piece of the puzzle that many financial educators are now sharing with the public, that it may be something people would want to consider if again, they have the risk tolerance for it. That's a key piece. So let me stop here and just kind of go through the chat and throw out a question while I'm reviewing, see if there's any comments. What do you think was the most significant personal finance event for you personally? So let's make this personal finance real personal. What do you think was the most significant thing for you personally? And I'm just scrolling through. I see a lot of links. I don't see necessarily any questions at this point. Okay, so we see 2 kids in college, turning 50, spouse retiring. Yeah, the constant chatter about military financial retirement. We're going to mention some military issues at the end. Identity theft. Hired a new certified financial planner. That's interesting. The changes in the Social Security claiming, TSP losses, military retirement. Okay, husband finished military service, went to a one-income household. Okay, yeah, that's a big change when you lose a paycheck in the family. New home, um, paying down debt, elderly parents, caring for them. Wow, wedding for a child, 2 children in college. That's expensive. Utilizing a financial planner. Okay, so several of you have mentioned seeking professional assistance with your finances. PCSing, of course, is always a challenge. Okay, so we've got lots of things there. I was just going to share two myself, and nothing that anybody has come up with. One is just I made a New Year's resolution to do the 52-week challenge, and it's now week 48, and I've done it every week, so I'm on track to have that $1,378. If you haven't heard about that, I can just Google 52-week challenge, or maybe Molly or Jerry can do that, and you can find a link for that. And I actually just created yesterday a $2,500 challenge that I just put out a link for as well, and just ramping it a little bit to have $2,500. So I'll be starting that in January. And then my other significant thing, which is just kind of a personal thing, is that I have winning tickets for American Faro at the Belmont Stakes and the Breeders' Cup. So that's kind of exciting and cool. Who knows in my lifetime if there'll ever be another Triple Crown winner, let alone a Grand Slam horse winner. Okay, so moving right along, just a little anecdote there. Let's talk about some other savings surveys that came out, just more findings from personal finance research. And this is one that was done, every year they do this one as well for American Saves Week. So this was from the Consumer Federation of America. And so they had about 1,000 adults as well, and they use cell and landline phones. And I think that's important because in research now, so many people have dumped their landlines and just have cell phones. So to really get a broad representation of America, you need to be able to access people by cell phones as well to really get a broader sample. So they did that. And they found small improvements in nearly a dozen indicators about savings, such as spending less than the income. They also found improvements in consumer indebtedness, as people owe less, which is a good thing. And then consistently, what they found this year, as they have in previous years, is that people who have savings plans, and a savings challenge could be a type of plan, because every week you know exactly what you're putting into your bank account or your jar that you eventually transfer to a bank account. So they found that the people who had plans of any type, whether it was locked in through their employment or something they were doing on their own, like a challenge, and they had specific goals, I will save X dollars by Y date, those people were more successful. They had more money saved, they were more successful in regular savings, and of course they had more money accumulated. So, and this held true at all income levels. It was more pronounced, not surprisingly, at higher income levels where people have more income and resources to save. But even at the lower income quartiles, those with a plan were more successful than those without a plan. So pretty important. 529 plan knowledge. Several of you mentioned 529 plans in college for your children. This was a study that came out. Edward Jones, the investment firm, did this study, and they found that 66% of Americans didn't even know what a 529 plan is. So this is really sobering for us in financial education and counseling, because we know this stuff, so we just kind of assume that everybody else knows it. But try to think of a situation in your life where you were in a parallel universe and people were throwing out terms that you didn't understand at all. I'll give you an example. I had to go to my dentist this morning at 8 o'clock in the morning. So I'm still unnumbing myself, so I hope I sound kind of good, because they numb me up really good to work on my tooth. But anyway, the dentist just kept talking about all these instruments, telling the dental hygienist, I need this, I need that, I need that. And it was like a foreign language to me. I had no idea what they talked about, other than my mouth was just being opened wide. They kept telling me to open wide. So think about that. When you're in a situation like that, where you were just clueless about what people are talking about, That's where a lot of people are that we're dealing with in our financial education programs. So maybe it's not so surprising that 66% of Americans didn't know what a 529 plan was. 41% thought it was a retirement savings plan, and 25% just said they didn't know. And yet, 529 plans have been around for more than 15 years. So, you know, it's not something that just came on the scene. We saw this year a couple of studies that were pretty prominent that had to do with the economic value of college. So this was one that was called the Gallup Purdue Index with Purdue University in Indiana. And they looked at more than 30,000 college graduates during the first 6 months of this year. And they found that the recent grads were significantly less likely to believe that their education was worth the cost compared to the older alumni who had graduated years before. And of course, one of the main reasons that was indicated was student debt. The flip side of that, however, is another study that came out that found that college degrees do pay off when you're looking in the aggregate with higher lifetime earnings. And they found that the earnings for the people with degrees were about $20,300 more per year over the past 4 decades. And then they did the lifetime return on investment of $420,000, more than that. And they found that the gap between people with a high school education and a college degree, it starts out relatively small, you know, $5,000 to $6,000, but then it grows over time. And then particularly as people get even more advanced education, the gap between a high school diploma and advanced education just grows over time. So again, something to think about. But again, when people are just out of school and the loans are pressing on them and maybe the gap between incomes isn't as great, it's not surprising that people might begin to question the value of their higher education. Okay, next one is kind of interesting is, oh, I think I skipped one here. Credit scores and marriage. This got a lot of attention on Twitter. If any of you are on the Twitter chat circuit, you know, Credit Chat and Cash Chat, they were kind of lighting up on this one. This is a Federal Reserve Board study. And they looked at credit scores, and they found that credit scores might be able to predict the stability of a marriage. Who would have known? So now we're going even beyond health and wealth. Now we're looking at relationships, bringing that into the picture as well. And they found that the people with the higher credit scores, and they weren't sure, the researchers, whether it was the score itself or the personal qualities that the score represented, which could be things like discipline, conscientiousness, faithfulness. I mean, you're faithful to making your payments or something. I don't know. They weren't exactly sure what the credit score, whether it was the score itself or something beyond that. But whatever it was, the people that had the higher credit scores were more likely to form committed relationships and marriages and to stay with them. And then conversely, if there was a gap, a wide gap in credit scores, the parties in that couple were more likely to break up. And they did control this study for a lot of factors, demographic factors that could help explain this, and yet it held regardless of those factors, education, race, income, and the like. So interesting study, and that one you should be able to get to the link directly on that one because that's coming from the Federal Reserve. They're not going to have a paywall on that one. And then growing wealth inequality. This is kind of a sobering study too. I found this originally in Financial Advisor magazine, and then I went to the primary source, which is Oxfam. So you've got links for both. You've got the summary article, and then you've also got the original study author and their press release as well. So they found that income equality, of course, is a big reason for wealth inequality. Of course, it stands to reason. If you've got a big gap in what you're earning, it obviously translates into savings and investments. And the racial and ethnic disparities are growing. And they also found that the racial wealth gap is growing sharply with age. So again, as people get older, the growth in the gap between the lowest and the highest in income and assets is increasing. And this statistic really took me aback. The richest 1% in the world will control more than 50% of the world's wealth by 2016. Wow. I mean, talk about a big wealth gap. And again, we're not just talking in the United States. We're talking about a lot of wealthy people around the world, but then we're also talking about a whole lot of poor people around the world as well, and looking at the difference. So pretty scary stuff there. Oops. I'm pressing too much there. Okay, another interesting study that came out was looking at investor sophistication and target date funds. And this had come out just at the time when we did our webinar on target date funds a few months ago, when we also looked at the L fund and the TSP. And this found, and again, thinking about situations where you may be talking with people or teaching about target date funds. It's one of the cases in personal finance where something actually jives, where you've got a product that is actually being used and is probably doing a good job for the people that it's intended for. So they found that people who had low investor sophistication were 22.2% more likely to use primarily target date funds. And for those of you who are not familiar, we're talking about the mutual funds that have a date in them, you know, like the 2040 fund and the 2050 fund, and they automatically become more conservative as you get closer to the target date in the mix that they have between stocks, bonds, and cash. So they did find evidence in this study that the investors who stand to benefit the most from target date funds are actually the ones that are using the product, which is a good thing, because that doesn't always happen in personal finance. You know, for example, we have a lot of well-intended tax credits, you know, retirement tax credit, for example, that are out there, but unfortunately the people that they're intended for don't always take advantage of them. But not so in this case. Okay, government data. I only have a couple of things here that I found that kind of came from government reports that I didn't mention previously. One, we got the General Accounting Office, and they did a study on retirement security. So this was a report. You should be able to access this one easily too, because it's a government website. So they looked at the SCF, or the Survey of Consumer Finances data, and they found, and again, this is pretty sobering, about half, 52% of people, households who were age 55 plus, have no retirement savings. You know, no IRA, no 401k, nothing. Pretty scary. And many of these people without savings have few other resources to draw on either. You know, they don't have a defined benefit plan, pension plan. They don't have any non-retirement savings, you know, maybe something in a taxable account, something like that. And then what they did in the report is they looked at what the median savings amounts would be, both the dollar amount and what it translates into as a monthly income. Because there is some evidence to suggest from other studies that when you show people what it amounts to on a monthly income, it becomes more personal to them, because they think of it like a budget item and say, oh my God, that's not very much money to live on. So what they did is they found that the median savings of the people who had savings, so again, remember that 52% had no savings, so we're talking about the other 48%, if they were 55 to 64, the median, again, meaning half below, half above, so it's the midpoint, is $104,000 for age 55 to 64, and that translates into about $310 a month. And then for people older, 65 to 74, $148,000, and that translates into about $649 a month. So again, not a whole lot of income for people to live on. And then the government also put out a study this year. This came through the census, and this got a lot of attention on social media as well as traditional media as well, looking at the gender wage gap, because that continues to be discussed in political circles, wage inequality and gender wage differences and that sort of thing. So they found actually that it's the lowest that it's ever been in history, which is interesting because it's still a gap, but it's a lower gap. And I can remember that. I can remember back in the 1980s that people were talking about 59 cents. Women were making 59 cents for every dollar that a man made. So now the gap is 21 cents. So the average woman earns 79 cents for the average man's $1 in wages. But again, it's not necessarily good news. What they found, they talk about in the report, it's that it's more of a result of a stagnation in the men's wages than it is an improvement in the women's wages. So it's not exactly a whole lot of good news there. But it did make a lot of news reports because, again, it was tying into an issue that's been politically active for the last couple of years. Let's just put it that way. Okay, so let me throw out a question. Any other interesting financial surveys that you remember, or any tidbits, something that I might not have found in the news that you just happen to remember? Maybe because it struck home to you. Maybe it was something personal that you could relate to because it involves something maybe in your family or with your clients. Anything that would be of interest just to share. Because I don't pretend to say that I've covered every research study that's out there. I did a pretty good job, though. I think I found a number of them. But if you think of anything else, and particularly if you have a link to share, by all means, put that in the chat so we have a record of those as well. Okay. So let's move on. And so the next topic, kind of a subheading, if you will, is different events, trends, and products that happened in 2015. So we're kind of moving from the research environment, and now we're just going to talk about, okay, what happened during this past year that had personal finance implications. So, of course, the big one that many of you mentioned in the chat when I asked about the biggest events was the integration of the Affordable Care Act penalty with the tax system, and we'll talk about that a little bit more on another slide. But it was the first time that many of us saw this term shared responsibility payment or individual shared responsibility payment. This is the term that the IRS is using to refer to what others have been calling the fee or the tax or the assessment or whatever you want to call it, the amount of money that people are paying when they don't have health insurance, which of course is now mandated through the Affordable Care Act. So 2014 was the first year that it went into effect. And then this year, 2015, there was an increase in the penalty, and then there'll be a further increase in 2016, followed by indexing for inflation afterwards. So in 2015, taxpayers who don't have health care, who don't have a plan, a qualified plan, would be owing the greater of, and notice I have greater in caps there, so whatever's higher, of the flat assessment or the percentage of income. So the flat assessment for 2015 is $325 per person with a maximum of $975 for the household. And the percentage of income penalty is 2% up to a maximum, because again, you can be including the whole family, of $12,850. So it's starting to be pretty significant amounts, and I guess that's what they had in mind when this law was drafted, is to make it so that it will be painful not to have health insurance. So there's a resource there with the calculator from the Tax Policy Center that can help people calculate what their penalty might be. Also related to the Affordable Care Act, we had in June a 6-3 ruling by the Supreme Court of the United States that upheld the subsidies, that portion of the Affordable Care Act, because there was a lot of question whether people in the states that went with the federal Affordable Care Act, the healthcare.gov, the residents of those states would have been able to get tax subsidies. But that was settled by the Supreme Court. And it was a good thing that it was, because when they look back on the season, 87% approximately. I've seen figures ranging all in the 80s, but this particular resource said 87% of those who bought a plan or re-enrolled in 2015, because they would have already enrolled in 2014, received subsidies. So 87%, that's a lot of people who, if that Supreme Court ruling had gone the other way, I don't know what would have happened, but it would have been painful for a lot of American families for sure. Okay, so that's affecting the Affordable Care Act. And then, of course, as I mentioned, for the first time in 2014, but it really didn't take effect until we filed our taxes for 2014 and 2015, was the integration of the Affordable Care Act and tax filing season. So this was our first year, and fair to say there were a lot of learning curves for a lot of people, and maybe some of you listening do tax filing or tax counseling with people, so I'm sure you can tell firsthand that it was kind of challenging getting on that learning curve. And then what made it even more challenging is that the 1095A form, which is the form that comes via the marketplace to inform people about the subsidies that they receive, so they can use that information to file additional forms that get attached to their tax return, those initial forms were incorrect. So that led to a lot of tax filing delays. So what happened is that there were a lot of issues for people. Now, for about 3/4 of Americans, it was just a matter of checking a box to say that you had health insurance, and maybe you had it through your employer, or you had it through your spouse's employer, or you maybe even had it privately, but some way you had health insurance that qualified. So the other percentage of people were the ones who had to deal with the tax system and actually fill out additional forms. And it became an issue, or a problem, if you will, because people don't have problems anymore, they have issues, for people who lacked the health insurance, or people who didn't do a very good estimate of what their 2014 income would look like, and then they were off on their estimates that informed their subsidies. So you had some people who had taken out too high of an APTC, which is an advanced premium tax credit, and if they took out if they estimated to have too high an advanced premium tax credit, when they settled up on their tax return this year for 2014, they either had a reduced refund, or even worse, they had a tax bill that they had to pay. And people had been warned. The marketplace was telling people if you had changes in your income, you should have been letting them know when that happened, but of course many people didn't. So it really took until they filed their tax return to be able to settle up with what their true subsidies were versus what they were actually estimating their subsidies could be. So we're going to see, this year will be the same thing. For this year's taxes going into next year, there'll be integration going forward, hopefully less of a learning curve for people now that they've been through it once. Also, interesting, we've seen increased health savings account use. Health savings accounts, of course, are a pre-tax savings plan for your out-of-pocket medical expenses. So in 2015, the contribution, the maximum that you could have put into an HSA was $33.50 if you're single, and then double that almost double, $66.50 for a family, and then there's $1,000 more you can contribute if you're age 55 and older for a catch-up contribution. But the thing is, with HSAs, you have to have health insurance with a high deductible, what they call a high deductible health insurance plan. So that high deductible has to be at least $1,300 for an individual, $2,600 for a family. Now, some financial advisors have recommended that if people particularly if they have good health and few out-of-pocket expenses, but yet they still have a high deductible plan. And increasingly, more and more companies, that's all they're offering their workers. It's just a matter if they have any choice, it's just how high the deductible is. But they're going to have the high deductible plan. So it could actually be what they call a shadow retirement plan. In other words, if you are doing this plan, you're funding the HSA, you don't have a lot of out-of-pocket expenses. Once you get to age 65, there's no penalty for taking that money out for a non-medical use. So in effect, it could become additional retirement savings for people. And also for people who are in that high earning category where they get hit with that Medicare, that surtax that came in a couple years ago, it can help to reduce some of the income for that. So it's a tax planning strategy, particularly for people who are a little bit more affluent, that last one. Workplace wellness programs. There was a regulation that came out from the Equal Employment Opportunity Commission. I have to remember all these government acronyms. And they said that U.S. employers can now reward their workers with up to 30% of the cost of health insurance in return for participating in a workplace wellness program. So more than a third of employers charge a penalty. And it averages about $50 a month, so it's not a huge penalty. But I found in an article that some are charging as much as $1,600 a year, so it's very workplace specific. So they're charging their workers penalties if they don't participate in the workplace wellness plans. And so what some companies are doing is they're removing the contributions to the HSA. Maybe they're charging tobacco surcharges. Some of this is related to state law. So what happens in one place may not happen in another. But again, the article gives a pretty good overview of what's happening there. But it's good to know now that at least there was some regulation, because up until April, some employers were hesitant to kind of go down that road because they weren't quite sure what the liabilities might be, and quite honestly, whether they would be sued by their workers for some of these, kind of carrot and stick approaches. But that, of course, is the stick. Another thing that got attention this year is Medicare turned 50 in 2015. So they rolled out a whole bunch of PRs calling it Medicare for a new generation. But one of the big issues that's coming to surface now, particularly with baby boomers who are working longer, is that we've got a number of people. It wasn't a big issue in the past, but it's becoming more, and that's why they're trying to do this Medicare for a new generation, is that if you've got a lot of people who are still working after age 65 and they're not claiming Social Security because of the earnings limit, what's happening is they're not in the system. So you just have to remember that if you're still working at 65 and you haven't claimed Social Security, and you probably wouldn't because you'd be paying it all back unless you had a very low income, your enrollment isn't automatic. So you're just going to need to caution people, if you're doing any kind of exit interviewing type of thing, that they have to go to socialsecurity.gov 3 months before turning 65 or within 3 months after. There's kind of like that 7-month window. And you have to sign up for the free Part A, and then possibly the Part B, depending on whether your employer will continue to provide coverage. For example, where I work at Rutgers, as long as you're working, your coverage through work is primary. Medicare, you still sign up for the Part A, but you don't need the Part B because you still have the employee coverage. But then you'd have to sign up when you retire. So people just need to know that because they want to. You don't want to have people, getting involved with any of these late penalties. And it's just very important that people also, you don't want to get involved with waiting periods as well, that they need to do this in a timely manner. So that was a big part of their campaign this year, was just warning people once they turn 65, if they're not in Social Security, you still have to deal with the Medicare, because even though the Social Security age for full retirement has been rising, the Medicare age has remained at 65. Okay, long-term care insurance. Policies are getting pricier, they're getting harder to find, and increasingly difficult to justify, according to one article that was in the Wall Street Journal. They found that the sales were down 24% from 2013. The costs of going up, so you can see the cost there for a 60-year-old couple for both. Again, there's a range there. And then, of course, if you add 3% inflation protection onto the base price of the long-term care policy, the range is even higher. And this was based on a typical policy with $164,000 of potential proceeds, so whatever the monthly amount was by the time period. And a new trend that we're seeing is hybrids. So what a lot of insurance companies are doing now is kind of hybriding long-term care with either life insurance, with annuities. They're blending financial products, which could be a good thing, but also could be a very confusing thing for people, because then you've got characteristics of two different products kind of being blended together. So they take a lot of careful analysis to be able to understand them. And then another study that came out was kind of interesting. It was the Center for Retirement Research. They found that nearly half of men's and 36% of women's nursing home stays don't exceed 3 months. So they're within the 100-day maximum that Medicare allows. And what they indicated in their study is that nursing home stays are shorter than what many people previously believed. So again, just another piece of information tying into that decision that people make whether they should have long-term care insurance or not. I know with my mom, she lingered in a nursing home, and it was right around that 100 days. So she really never would have used a long-term care policy had she had one. Okay, moving right along. Pension pressures. So what we saw in 2015 was increasing numbers of workers receiving what we call lump sum versus pension offers. So their employers are sending them a letter, and they're basically asking them to give up their future monthly pension in exchange for a lump sum. So basically exchanging a sure thing, the pension, versus an unknown, because again, you don't really know how your lump sum is going to last and how it gets managed. And there's been 400 company offers since 2012, and they were expecting dozens more this year. And they're saying that these offers are coming because of some new regulations, the low interest rates, which make it very challenging for employers to set aside sufficient monies to pay promised pension benefits, and then also increasing premiums to the Pension Benefit Guaranty Corporation. So these were all factors that we're kind of playing into that. And then the other thing that people need to remember is that if you put the money into a traditional IRA, then of course you're subject to all the required minimum distribution rules that would take effect. So that's another thing to consider that was mentioned in the article. Along with pensions, a little bit more, public pension woes. So there was a study that came out, this was published in the Journal of Financial Planning in July. 87% of 82 state retirement systems, I guess some states have more than one, reported data for 2014 and said that they were underfunded. And the top 10 states, and this is not a list that you want your state to be in, because it's the 10 states with the most underfunded pensions. And you can see the list there. I know Illinois has gotten a number of articles written about its pretty dire situation. Connecticut, I see a lot of articles about them living in the tri-state area. So yeah, those are the states that really have it pretty bad for their public pensions. And they actually have 3 alert categories that they use. So a state could be deemed critical, severely endangered, or endangered. Those are the kind of the tiers that they use to describe that. Bank fees have been in the news, and some articles came out a few months ago. 72% of the largest U.S. credit unions are offering free checking versus only 38% of large banks. So to the extent that you and your clients may have access to a credit union, might be something to consider. I know many of the credit unions have, they now have additional avenues to become a member than you would have had in the past. I know there's some credit unions here in New Jersey where if you make a donation to their charitable foundation, that enables you to become a member of a credit union, where in the past you would have had to been working for a company or been in a certain church or something like that. So there's more avenues to be involved in credit unions than would have been in the past. And then the ATM fees have continued to rise. The average is $4.52, and in some places they've been as high as $8. And that came from an article in the Wall Street Journal. Same-sex marriage came into the rule. It came into financial planning rules. You know, it has some effect there. So the Supreme Court, fair to say, was pretty busy this year between the Affordable Care Act and then the ruling that was made that same-sex couples have the right to marry in every U.S. state. So the personal finance aftermath of that is that same-sex couples can file joint federal and state income tax returns. And by doing so, they will incur either a marriage penalty or a marriage bonus, just like heterosexual couples have had for years. You know, and it really depends a lot on the weightings of the earnings in a family. For example, do you have two spouses in a couple that are each earning $50,000 versus another couple with a $100,000 income, and one earns 95 and the other one earns 5. So either way, there could be a penalty or a bonus depending on how the incomes shake out in the same-sex couple. And it also affects eligibility for Social Security spousal benefits, some of the Social Security strategies, eligibility for pension benefits, and also spousal asset inheritances and estate tax exemptions. So a whole wide swath of personal finance issues have been affected by that Supreme Court ruling. And then another thing that we saw this year is the increase in what are affectionately being called robo-advisors. So we've got these new companies, online companies, Betterment, Wealthfront, Future Advisor, and there are probably others. And they continue to have a growing, what we call AUM, assets under management base, over $2 billion, primarily from the millennial generations. It's still a small percentage of the wealth that's being managed in this country, but it is growing. So much so that many of our traditional firms, Schwab, Vanguard, Fidelity, have now launched automated services to kind of compete with these robo-advisors. And what they're really doing is targeting young people, people who are self-directed, who want to make their own investment decisions, and people who are tech savvy. And the jury is still out whether this will complement or threaten some of the human advisors. The financial planning community is still kind of asking this question. So there are some articles that talk about that. We saw a change in the 529 plan rules, and this was included in the ABLE Act, which was signed right at the end of last year, and it allows people who have 529 plans to change their investment holdings twice a year versus once. And some people have said, well, this way people don't feel as locked in, and it gives them at least an ability to make changes with their plans a little bit more often. So that was something else that came out. Student loans, of course, have been in the news, and if you don't know it, there is actually a student loan debt clock. So that's the first link there. And it's just like the U.S. debt clock that is in Manhattan and New York City, where the numbers are just constantly blinking and changing. So it's over $1.3 trillion. It was reported that nearly 7 million students with debts haven't made a payment in a year. And some 94% of private student loans are co-signed, and that's up from 77% about 7 years ago. So those were just some interesting statistics about student loans. Credit card security upgrades, we talked about this in the chat. So as of October, merchants have to foot the bill for any transactions that are fraudulent if they haven't upgraded their terminals to accept the more secure cards. So I'm sure many of you have received new cards that have the chips. They're referred to as EMV terminals, Europay, MasterCard, and Visa. So what's happening is the fraud liability is now shifting to the retailers from the creditors. So you're likely, if you haven't started dipping your card into a terminal instead of swiping, you'll be doing that soon. What they have found is that, interestingly enough, is that if people in the process of getting new cards are getting new numbers on their cards, it's causing a lot of turbulence for the subscription services. So people who have had their gym club memberships, their Netflix, their Sirius XM radio, anything tied to automatic credit card payments, when those credit card numbers change, you have to kind of redo these subscriptions. But they're also saying it might be a good opportunity for some people who haven't been using the gym to maybe just drop the membership at that point, because it's not going to be charged to their credit card anymore because it's a different number. So something to think about. There's always aftermath to a lot of these different events. Credit scores, another big thing that we saw this year is that the majority of big banks now are offering free FICO scores to their customers. Some are doing it right on the statement. Some of them are doing it through the online access or through a mobile app. USAA is providing free Vantage scores. And Experian, the credit reporting agency, and they've been doing this for several years, but they've really been publicizing it in 2015, allowing monthly rent payments to be reported by landlords as evidence of creditworthiness. And this is really good for people who are young, maybe haven't had much of a credit history with credit cards and loans. And again, assuming they've had a positive history with their landlord, it can give them a boost with their credit history. That's out there. Good news, bankruptcy filings are down. So this was a report that came out from the Bankruptcy Institute, American Bankruptcy Institute, in January 2015, looking back on 2014. And it was the first year that we dipped under 1 million annual filings since 2007, since the financial crisis. So that's a good thing. It's still a high number, 910,090 bankruptcies. What they cited as some of the reasons were the high cost to file and sustained low interest rates, maybe having less pressure on people financially with lower interest. So that was a good piece of news. Another good piece of news was the sustained drop in gas prices. So they looked at the first half of 2015 and estimated that it saved U.S. households $65 billion. But where has that money gone? A lot of the retailers expected it to go to their pocket, and it hasn't. So the retailers, for example, Macy's just announced it's going to be closing 40 stores. So it's not going to clothing, it's not going to home furnishings. It's being spread very unevenly throughout the economy, where they are seeing increased spending and also some increased savings, which is good. But the spending is going to healthcare, autos, travel, hotels, and restaurants. So it's going to a lot more on experiences rather than stuff. And an article came out that really kind of hits this home. And I remember talking about this to my students in class. And I asked them, I said, if I could give you $600, would you rather buy something like an iPad, or would you rather have an experience, go travel somewhere? Everyone in my class said they would like the experience. So what they found in this one article is that the millennials are placing a much higher value on experiences over stuff, and the boomers are starting to do likewise for different reasons. You know, the boomers, of course, are downsizing. They don't need any more stuff. But you've got two very large generations that are converging in their preference for doing things and having experiences versus buying things, which of course kind of plays into why our retail sales have been so sluggish in this country. Speaking of sales, one thing that we did see, perhaps again to encourage shopping any way that it can, is that layaway plans started earlier. Walmart announced their layaway plan even before Labor Day, trying to stimulate some sales. So those are some stock shopping trends. I put these slides together about 2 months ago, and everybody was pretty much trying to say, are we in a bear market or not? We've, of course, had much better stock reports since October, but in late September, we had a number of people who were calling the correction an actual bear market. Another article did come out related to stocks too that was just saying that you have to be real careful with those target date funds, because some of them still hold a significant amount of stock close to retirement age and even after retirement age. And we talked about that on the webinar, that you can have some that actually plateau at retirement age and some that go through retirement and may not plateau for another 10, 15, 20 years. Some other good news, Madoff victims. They're actually going to do pretty well, many of them. Of course, we all know this was a scheme that was detected in the fall of 2008 in the midst of the financial crisis. And it was announced in October that the Madoff victims with less than $1.1 million in losses are going to get all their money back. And that's about 56% of the victims. So that's really good. A lot of the money is actually coming from the widow of the lawyer for Bernie Madoff. That's $7.2 billion. So this was declared a major victory, but of course, the one thing to keep in mind, it's not typical for fraud cases. In most fraud cases, the victims get back nothing. But that's good news. Good ending to that story. Let's see, housing market trends. This was an interesting piece of research. National Association of Realtors was predicting that less than a third of the families who lost their homes to foreclosure in the last decade are likely to become homeowners again. So the implication for that is that the pool of home buyers, new home buyers, is not as big as some people were expecting. And this is playing into a sluggish housing market in many areas of the country, even though we're still, we're 7 years out from the height of the financial crisis. And it's not a good housing market in many places. And some of the reasons that were given were inability, ineligibility to borrow again, and also maybe people that just burned and they just don't have a desire to buy another house and go through that again. Cell phones. This is kind of interesting. I found an article that said nearly almost anybody with a cell phone these days is a smartphone user. So there's not too many of the dumb phones around anymore. And the subsidies are going away, because why subsidize something when everybody has it, right? So you're going to see fewer subsidies. We're going to see fewer contracts tied to cell phone purchases. So the bottom line is, when people are wanting to get their next cell phone, you really should be shopping your service, because the kinds of programs that you had available in the past may not be available going forward. So you really need to reshop. And then the other thing that has come on the scene in 2015, and I don't know if any of you have been on Periscope or Meerkat, where you've got live video streaming, they have become the new data hogs. and you can blow through a data plan on a Periscope in no time. So just remember, if you're going to do live streaming video, you better be on your on a Wi-Fi and not on a data plan, because you'll just be paying extra overage costs. And these things just came out this year, Periscope and these are brand new services that just came out. Car buying, they announced in August this is the fastest pace of car sales in 10 years. So even with the stock market being kind of funky back in August, they were saying that. Some of the reasons, financing incentives, low fuel prices, and it was one of the best sales years for the auto industry since 2000. So I think you had a lot of pent-up demand too. People were driving around a lot of older cars and eventually just needed to replace some of them. So that's another trend that we saw. So let me throw out a question. Anything else that I missed that is an event or a trend or a product that happened this year that affected people's finances? Is there anything, just think about yourselves, anything that affected you financially that I didn't recap? I try to go through a lot of articles, but I'm sure I don't claim to have covered everything. So if there's anything that I missed, please mention that. Okay, so as we wind down on our last 15 minutes or so, what I want to share is some resources. And also, okay, let's see. Before we do that, we have a couple more government legislation things. Okay, the MIRA. Okay, yeah, let's do that, and then we'll go into the resources. My mistake. Okay, so back in 2014, in the State of the Union address, President Obama was encouraging a plan that would help workers save for retirement when they're in a small company where maybe there isn't an employer 401k plan or something like that. So they proposed this MIRA, and it's actually spelled with a lowercase my and then IR, the RA, so it's supposed to rhyme like with IRA for an individual retirement account. But it's personal, so it's MIRA, and it's kind of been called a Roth IRA on training wheels. So there's no fees, there's no account minimums. When you hit $15,000 or 30 years, whatever comes first, then the money would be transferred to a private sector Roth IRA. So it also has a secondary role to be kind of a reserve fund that people could withdraw back their own money, just like a regular Roth IRA, you're always able to access your own contributions. So it's been a very slow rollout process over the last year and a half since this was first proposed. The official rollout was earlier this month. There is a video that you can watch from the Treasury Department. And as I said, if you want to know more about MIRA on Friday at noon Eastern Time, E-Extension, the Financial Security for All community, will be doing a webinar, and it's actually the speakers are from the Treasury Department, so it's actually going to be coming from the people who rolled out the plan. So that's new. Of course, income tax highlights this year. We had the health insurance penalty that I mentioned. We had slightly higher tax-deferred retirement account limits. So for the plans, it was $18,000 as the max and $6,000 for a catch-up for, let's say, a 403B or the TSP plan. Starting in 2015, you could only make one rollover from an IRA to a new account within a 12-month period. And this doesn't include direct transfers from trustee to trustee. It was really designed to prevent people from kind of giving themselves a short-term loan interest-free. So they kind of clamped down on that. Of course, the federal marginal tax brackets were indexed, as was the alternative minimum tax, the indexing for that as well. And then we also saw increased attention to identity theft for income taxes. So there was an announcement that was made this year that there will be increased cooperation between the IRS, the states, and the tax prep firms to deter identity theft. And they estimated in 2013 the IRS lost $5.8 billion to stolen tax refunds. And at least 12 states are going to be requesting the W-2 forms earlier from the employers because they want to try to get the W-2s before the tax returns are submitted to head off any evidence there of identity theft. And they've warned people to be expecting more security in the future. And again, I've just been warning people to minimize your tax refunds in the first place so that you don't have money stolen. You know, if you don't have the refund, it can't be stolen. You could still be a victim of identity theft, but you won't be waiting for your own money. You will have already had it. Okay, so any other interesting financial legislation and policies? If you think of anything else there, let me know. I do have a slide on military financial events, and I guess the two big things that kind of affect personal finance, the report that was issued in January on military compensation and retirement modernization, commission report. That's a mouthful. And I don't really have an update on that. If anybody does and you want to share information in the chat, that would be great. And then the rules for the Military Lending Act. And we actually had a webinar on that in July, and we had Marcus Beauregard talking about the final regulations. So those were two big ones, but if you heard anything more on either on these two laws or on anything else that would help with the military, that would be great, you know, to share that, because I'm not necessarily privy to all of the discussion that's taking place in military circles, kind of in the aftermath of that report. But it certainly did generate a lot of interest, and fair to say probably a lot of concern and worry about those who would be affected by some of the you know, recommendations made in that report. Okay, so finally, let me talk about some resources that are out there that came out this year. And some of these are kind of annual updates to a resource that's always available, and then some of them are just new things that came out for the first time. So I've shared this many, many times with you. I call it the Bible. It's just a two-page summary of all the annual limits relating to retirement planning. And I take it with me everywhere I go because invariably somebody is going to ask a question, well, what is the exact limit for, you know, deductibility of traditional IRAs or something like that? And I can't possibly keep all those numbers in my head, so I just whip out my little handy-dandy sheet and I have all those numbers. So they update that every year. Another thing that really came on the scene starting in 2014, but it really blossomed in 2015, is Next Generation Personal Finance. And they have just created a wealth of resources, particularly for the K-16 education population, you know, teachers of high school, you know, and college, even middle school, you know, basically young adults, personal finance, and they've now got just a wealth of resources, lesson plans, archive videos, archive case studies, assessments. If you haven't been to their website, really check it out because there's just so many different resources. I actually put in to do a sabbatical in another year, and I hope to actually just spend a week just going through all of the material that they have developed. It's just that extensive. We also started this year at Rutgers Cooperative Extension with some funding from the state of New Jersey. We're going to be rolling out every year some lesson plans. So these were the first 5 lesson plans that we rolled out. They're geared toward high school population, and they're tied to our state standards, but I'm sure our state standards in New Jersey are like many of your standards in other states, and they address some of the key topics in personal finance. So these are all available for downloading. Each one has about 5 different learning activities, and it could actually take a week to do each one if you did every learning activity, or teachers can just pick and choose what they want to use. And then every year the Jumpstart Coalition puts out the Making the Case for Financial Literacy. And so this is the updated case for 2015. It just contains a lot of statistics. if you need to convince a legislator or a school administrator or anybody about the need for financial education. It gives you just a whole lot of ammunition to work with. Really good. A couple groups put out curated lists of resources. So this is where people took the time to actually see what's out there and create a list. So there was a group called Edudemic, and they put out some resources. And then the Jumpstart Coalition had their Financial Educator Conference in November. So they compiled a list of resources that they gave to the participants in that conference, and then they made it available online. Hire One did another list of resources, and the Youth Involvement Board, which is affiliated with credit unions, it's their youth outreach, they also had a list of financial education resources. And then our final segment today, we kind of like to wrap up these annual updates with just kind of a preview of what's coming ahead. But as we wind down, if any of you know of any additional resources that came out in 2015, please list them. And if you have a link that you can share, that would be great as well, just so people can check those out as well. So what can we expect for 2016? Because it's only a month away. And by the way, you have 1 month to make a difference for 2015. There was just an article in the Wall Street Journal that I shared with my class yesterday that pretty much said there's not much you can do once the year is over to affect your tax situation. So you have a month to maybe make some tax-deferred savings, or possibly make some changes with investments, perhaps, things that could affect your tax situation. But starting next year, I already mentioned there isn't going to be any cost of living adjustment for Social Security recipients, because it was deemed that inflation, the rate of inflation as measured by the Consumer Price Index, wasn't high enough to have a COLA increase. So that affects Social Security recipients. It also affects recipients of federal retirement plans as well. And the main reason that was cited was because the gas prices were low, and therefore the Consumer Price Index change was low. Of course, we all know that CPI probably isn't the best barometer of real families' cost of living, particularly retirees who have higher healthcare costs than average. But it's the law of the land, it's what they do, so there is no COLA. There will be the same maximum taxable earnings as 2015, and the same earnings limit under full retirement age as 2015. So those numbers will remain the same, and a quarter of coverage will inch up slightly to $1,260. Retirement savings plan, not a whole lot of change there. It's pretty much the same across the board. So it'll be the same maximum contributions for all of your employer tax-deferred plans, including the thrift savings plan for the military and federal government community. Same catch-up contributions, same annual defined contribution limit for your plans. So that's pretty much the same. Standard deductions for singles and married couples, also going to be the same. Personal exemption is going to go up $50. Slight increase in the alternative minimum tax exemption, and a rise in the estate tax exclusion. So that will go from $5.43 million to $5.45 million next year. Okay, so that's pretty much what's happening in the world of personal finance in 2015. So again, going back to our 4-H model, we told you what we were going to tell you, we told you, and now again, just kind of summarizing some of the key takeaways. Hopefully you've seen that retirement is going to be expensive, and particularly on the healthcare side, many people are just unprepared in the amount of money that they have set aside. Also indications that people don't know a whole lot about 529 plans or health insurance. The integration of taxes, income taxes, and Affordable Care Act penalties, the security upgrades on the credit cards, changing shopping preferences, and the modest changes that we can expect for next year. So at this point, I'm going to turn it back over to Molly to just wrap us up and tell you about continuing education credits and some of our upcoming events.
Thank you, Dr. O'Neill, for that great presentation. There was a lot of great information shared. If we could just advance the slide so we can provide folks with the CEU information. Thank you. One more. And if you need to get in touch, there we go. This webinar is approved for 1.5 CEUs for AFCs and CPFCs. You can complete the evaluation, which I've shared in the chat box, and at the end of which you'll be directed to a quiz for your continuing education credits. You'll get a certificate of completion if you pass of 80% or higher, and that will be sent to your email address. And you can click the link live in the chat pod and get all the information you need there. If we can advance to the next slide, I'll talk a bit about our upcoming webinar on January 12th about the Thrift Savings Plan review. Stuart Kaplan from the Thrift Savings Plan training office will be providing this webinar for us on January 12th at 11 a.m. You can learn more about that at learn.extension.org/events/2361. And I will continue to share the link to the evaluation in the chat pod, and I will turn it over to Coral. Thanks, everyone.
Thanks, Molly. If we could just advance to the next slide, please. I'd like to invite all of y'all to explore the professional development opportunities, both upcoming and archived, offered by the MFLN by visiting www.extension.org/62581. These webinars are offered not only in the area of personal finance, but also military caregiving, family development, family transitions, network literacy, nutrition and wellness, and community capacity building. I'd like to thank Dr. Barb O'Neill for sharing her expertise today, and to the personal finance team and our counterparts at the DoD for hosting today's webinar. We hope to see you at another MFLN learning opportunity in the near future. We'll go ahead and stick on for just a couple more minutes. If you need to ask any questions of the personal finance team or grab any links from the chat pod, but we're very thrilled that you've joined us today, and we wish you a wonderful afternoon and hope to see you again in the near future. Thank you.